everybody, and welcome back. Today, we're going to be doing our second podcast with Carmen Simmons, who is on Twitter at Where in My World. In our first podcast with Carmen, we talked about social media and how that plays into her day-to-day experience as a medical student, and a little bit specifically about the cost of medical education, which was a tweet that had brought her to my attention and how we got to know each other initially. In this second podcast, we're going to be shifting gears a little bit, and we're going to be talking about promoting diversity in medical education and also really important things to keep in mind when serving underserved communities in medicine. And I think we're going to have a really interesting conversation, and I'm really excited for this conversation, especially as we're looking toward Black History Month in February, and also looking on all of the progress that I think that we as medical students and the medical community are really pushing to make, especially throughout the past year, to really start to solve these systemic issues in medical education and medicine for our Black and other underserved communities that we work with day to day.
Awesome. Well, thank you once again for having me. I'm really excited. This is something that's really a big passion of mine. I really can't understate that enough. Like, this is a really, really big passion of mine. And I'm just happy to be here. So thank you.
Awesome. So first, I thought we'd talk a little bit about, since you go to Meharry Medical College,
Yes.
and you've now, in your last semester, soon get a match, go through match day. If you could tell us a little bit more about maybe why specifically in HBCU medical school and
Mhm.
your experiences there.
So, like you said, I'm Carmen. I'm an M4. It was my last year. Thank you, Jesus. Um, and really, a lot of my first encounters with. So I'm from Atlanta, and I think we talked about that a little bit on a separate thing. But like, I'm from Atlanta. Atlanta is really, really great about having a lot of a huge Black population that really stratifies a lot of socioeconomic ranges, really stratifies a lot of different jobs, different career paths, different journeys. So for me, growing up, I saw a lot of Black doctors as a little girl, which is not something that's like really typical of a lot of other Black medical students, or just like in general, like the general population, just seeing a lot of Black doctors. So for me, it was very, very normal for Black people to be doctors. I know that sounds, it should not sound as radical as it is, but it really is a big difference in how I literally grew up seeing that. And a lot of people do not. So that was a huge thing to shape who I am as a person, shape who I think I could be, or, what my options were. And I know that a lot of the Black doctors that I knew went to Meharry. Like, I just, when I was going through my path and, starting to really become interested in medicine and, talking to people, a lot of the doctors, they were like, oh, I went to Meharry. I went to Meharry. I went to Meharry. And I was like, oh, okay. So I'm going to, so to be a doctor, you go to Meharry. And so I didn't even know it was HBCU until I mean, I guess I was like grown, but I had no idea. It was just like, it was a doctor's school. That was all I knew. It was, you want to be a doctor, you go to Meharry, the end. And so, and Meharry's done so much for our culture that, it really was for me. If you wanted to be a doctor, you go to Meharry. And I mean, of course, later on in my path, like, I found out there was other medical schools. Like, you didn't have to go to Meharry to be a doctor. But I mean, that was foundational for me. Also Morehouse. Like, so if you wanted to be a doctor, you go to Meharry, you go to Morehouse. Like, those were the schools. And I mean, it makes sense because for a long time, Meharry, Morehouse is actually a newer medical school, but if you were a Black doctor, you went to Howard or you went to Meharry because those are the schools that were accepting students of color. So those are the schools that you did if you were a Black doctor. And then after that, going through the process, going through college, etc. Still lots of stuff with SMA, which is Student National Medical Association, and then of course with MAPS too. So that was their pre-med society. It's it's not that I didn't actively choose Meharry, um, but it's something that has always been a part of like where I envisioned myself, how I thought I was going to be, where I was going to go. Um, it just always seemed like it was there for me. And like I said, once again, a lot of my mentors, a lot of the people I know, a lot of, especially, and then, especially the old Black doctors. Once again, because, and it's sad because when you think about it, there was a reason why all the old Black doctors are from Meharry or Howard, is because that was the only place they could go. And when you think about it like that, that's sad. But when you think about it on a surface level, like how you get introduced to it, it was once again, if you wanted to be a Black doctor, these were the schools you went to. And that's, if you wanted to be like your mentors or you wanted to, these are where you were going to go. So that's really how I was introduced to Meharry. Also, my aunt went to Meharry. So she's a Meharry grad. So she's an anesthesiologist. Oh, Jesus, she's going to kill me. She's a radiologist. We're just talking about anesthesia. I'm sorry, auntie. And so yeah, and I mean, I love it. I know maybe that's not the perfect answer, but it's just Meharry has really just been so ingrained in what I see as a doctor, who I've met, who are doctors, who were my doctors growing up, etc. Like that's what it was.
Wow, that's great to hear and to learn more. And I hope our listeners are enjoying learning more about this as well. So what do you think are some common misconceptions about an HBCU medical school?
In a nice way. Like,
Yeah.
and I mean, the biggest misconception is that it's easy, that they're inferior, that they take students with bad grades and bad MCATs, and they're not giving you the same level of training and etc. It's like, and here's the thing, like, so as far as the GPA and MCAT requirements at HBCUs, they're typically lower. That's not something that is a secret. But the reason behind that is this, little thing like systemic racism. And over again, it's been shown that students of color, Black students, Latino students, Native students, statistically do lower on these tests. And it's not because we're stupid, right?
Right.
And I mean, once again, it shouldn't be radical, but it's not. It's not. It's literally studies and studies and studies have shown again and again. It's about what resources you have, the exposure you have, what, ways that you can prepare to get into medical school. And that starts literally from pre-K. Like that doesn't start with the MCAT. Like that starts with the SAT. And this is not just a medical school thing. This is like SATs, ACT, the LSAT, like all of these, consistently proven again and again that it's discriminatory towards people of color. And it's not because we're stupid, right? Because maybe I'm not saying there aren't stupid people of color. What I'm saying is that if something's happening again and again and again, maybe it's not something that's the exception. Maybe it's the rule. So it's just like, and then of course, you have people who do, and it's not like all Black people and all people of color do bad on the MCAT and do, like that's not what I'm saying either. Like, please keep that in mind. But the thing is, there's clearly a systematic problem, and people try to ignore that or try to say there's other things, etc. And honestly, you can't argue with facts with people like that, because there was no intention to ever be understanding or ever like acknowledge that. There was always just something to be antagonistic to. So that's like a really big misconception. And then also just the inferior care or inferior training. So a lot of HBCUs don't have the same endowment, don't have the same amount of resources, departments, etc., research opportunities, technically, blah, 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 right? So once again, they're like, oh, well, that's not a good school because they don't have this or that, or they don't have as much of this or that. And once again, and I mean, like, I know I sound like a broken record, but it really just comes back to systemic racism. Like, this is something that has been going on since the dawn of time for us, like in the country. Like, I mean, of course not, whatever. But the point is, like, and it's not that these things just appear out of the blue. It's not that we don't want this, we don't want that, or like whatever. These are things that have been very much placed against us. And then especially if like an institution like Meharry, like God, how old are we? We're like old. We're old school. Like we are an old school. And to have survived this long and produce the doctors and the training and the impact that we've had as one school in the country and the world is not easy, especially in given the fact that like on at every step of the way, and even till this day, every step of the way has been met with such antagonism and so hostility. And like this is not our first rodeo. This is something that is clearly and that's Howard, that's Morehouse, that's other HBCUs, not just like in a medical school setting, that's for the law schools. Like this is something that every step of the way, and I mean that's tiring. Like so that's another misconception. And I think those are really the two main misconceptions, is that we have inferior students, we have inferior training, and people are like, they're not as good of a doctor or something of that nature or whatever. And I think that is, I mean, I cannot disagree with that more. I mean, of course, like it's med school, so it's like, um, do I love everything about Meharry? No, like that's come on. But at the same time, is it because it's a HBCU? No. Like if I went to any other med school, I'm sure I would find things I did not like about my school. That's the nature of medical education, or that's the nature of education in general. Like you don't love every single thing and every single day, or every single person that's at the school. Like that's just how it is. But and of course, like there's positive and negatives, or like, do I wish we had more of some things sometimes, like, and that's my own selfish thing. Like, do I wish we had more of like, I don't know, um, this is a little bit, is actually a bad example, but like, do I wish we had more Spanish training? Yes. But then I decided, okay, I wish we had more Spanish training. So I helped create a Spanish training module for medical Spanish, and, help other students. And now we have classes now. So it's like, once again, at any other school, I feel like too, like if I decided, or like I said, oh, hey, we have a need here, let's, focus on this. And the admin is like, oh, we do have a need here. Yeah, we're right. We should have more of a formalized Spanish, not track, but like formalized Spanish resources, and et cetera. And they did. And we have. So like, and I think, yeah, that's really what I would say. And it's infuriating. It really is, because it's racist. It's based in racist notions. So,
Right.
and
I
there's
think
no way to get
that,
around that.
right. And I think that one misconception to then go off that point
Mhm.
is that all the other medical schools, especially in the South, are doing enough to actually teach and explain and make sure that students, especially students like me who are white,
Mhm.
understand that systemic racism and why um, those disparities still exist in healthcare. When you apply to medical school, they meant when I was applying a few years
Mhm.
ago, they would mention, "Oh, we're doing these things on diversity and in medicine and serving underserved communities, and you'll get all this exposure here, there, whatnot." But when it came down to it, especially within the past year, was that there was definitely not enough being done. And so the misconception is really that the rest of the medical schools aren't doing enough. And luckily, there's so much more attention to that now that change
Mhm.
will come and has been coming, both at the individual level of people working to learn more and be more aware and compassionate, and also at the educational level, because it's something that, you know, it's one thing to be working, for me in my perspective, to be working with an underserved community at a TB clinic in the community, or at the public hospital, University Medical Center in
Mhm.
New Orleans. But it's another thing to really actively engage and think critically about the experiences of your patients, instead of just passively taking care of them and being like, oh, I'm getting this exposure to this patient pool. No, that's definitely not enough. And I think that's what has really come to light more recently that needed to be addressed further.
Yes, I think, I mean, so, and you're right. Like, so given the recent years, like there's a lot more attention that's brought to it. And Meharry, this is this has been Meharry's mission since day one. Like, this is not like, oh, you'll get extra exposure, or like if you want to take this elective, like this is it. Like we are the safety net hospital in Nashville. Like, period. Period. Like, we are the safety net hospital. This is our patient population. This is not um an elective. This is not anything like this. You go through rotations. This is who you are going to be treating. And I mean, for me, like, this is something clearly near and dear to my heart, and it's something I want to do. But you're right. I feel like if I had gone to another medical school, I would have to be more active in finding those opportunities and like doing those things. And then I also feel like as a student, there would have been a lot more pressure on me to like help teach my classmates and stuff like that. I don't have time for that, but I also don't have time for that because I'm a good student too, like, to take on all that extra work. And then it's my professor. Like, we have a very, very integrated curriculum when it comes to caring for social economic disadvantage. I mean, this is like, we have a strong LGBT curriculum. We have a strong, I mean, by nature, right, a Black curriculum. We have a strong, just uninsured, underinsured curriculum. And then it's not just talking about it in class and not really talking about just like in general. This is what our rotations are. Like, this is for peds, this is for internal, this is for family, this is for OB, this is us. So,
Right. So tell me a little bit more about, especially over last summer, the social justice movements and the increased emphasis on Black Lives Matter, how that played into your experience at Meharry and
hmm.
the experiences of being a Black medical student at this time.
Yeah, so once again, incredibly blessed that I didn't have to teach my classmates about, Black people being people. Which, it's when you think about how, and I have a lot of friends who are in other medical schools that are Black. I actually helped create a group for Black medical students who are applying to family medicine for this match cycle. And I'm also in another group with Black medical students of 2021. So like, those are from everywhere. That's not just like Meharry and Howard and the Morehouse. That's here, the Caribbean, DOMD, that's everybody. And a lot of my peers that were at medical schools, like, they had their classmates are saying like really outlandish things, their faculty saying outlandish things, their I mean, of course, patients in general, you can't really help that as much, but they're saying outlandish things. And they're distraught, like in the middle of like, preparing for step 1 or step 2 or boards or shelves or whatever they're doing, or just once again being a medical student baseline. And there's not a lot of being, and for Black students, you can't turn the TV off and be like, I'm not engaging, because you still know. And I think for a lot of our like white allies, or not even say allies, but just white counterparts, they can turn the TV off and really be like, you know what, I'm just gonna focus on school, which is it's an incredible like privilege. And I know that sounds like, I know we use that word a lot, but like, for me, like, it wasn't being able to just like, oh, I can just turn it off and just not think about it, or because it's my community. Like, so it's not even that, just my colleagues are talking about it. It's my family who's talking about it. It's my friends who are talking about it. It's everybody who's talking about it. There's no escaping for me. And then, I mean, baseline in general, just talking about it, but like, also, this is like my experience on the world. Like, this is who I am. And to be at a HBCU during that time is invaluable, because I and like, I'm not saying every other medical school that was doing this, but like, my school, once again, since day one, this has been who we are. This has been what we've been doing. But the president of our school came out and said something, and not like, tiptoeing around the issue, like came out and was like, no, this is wrong. This is what, this is how this affects our population. This is how it affects our students. Our, oh, Dr. Kimbrough, love her. Oh my God. She's our, oh, I should know what this is. She's like, she's our chaplain, but like also like, she's just like the best person in the world. And you can just go to her for anything. She came out, she was like, hey, we have, extra sessions, like if you want to meet with me, if you want to talk with me, blah blah blah. Our counseling center, they were like, hey, we know what's going on, we'll be offering extended hours, etc. Our faculty came up, a lot of our faculty and a lot of alumni spoke up and were like, hey, this is what's, and I think for me it's really nice because I didn't feel isolated in the situation. I know a lot of my friends who are other medical schools felt isolated and that they didn't have anybody support them or people were acting like it wasn't happening, or they were also saying crazy stuff, like, and racist things. And they're the guys of like, oh, I just, don't like property damage or something like that. But like in a way that wasn't the same when other situations of property damage happened. It was just, oh, I don't like the property damage in this one specific instance, or, this doesn't happen, or basically suck it up, or you shouldn't be stealing, or blah, 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 or we're past this now, and etc. And I didn't get any of that. And I'm not, I don't want to say bragging, I don't know what the word is, but it's just like, I felt supported. I felt safe. I felt respected. I felt like there was places I can go, people I could talk to, and not even just like one specific person. Like I could talk to anybody on my campus and be supported and feel like I had a safe place to go. So, and I cannot imagine what it would be like going through these last 4 years in a place where I just did not have that type of support or love or advocacy, even when I couldn't be an advocate for myself or couldn't be advocate, because like I'm studying, I'm doing things, like I'm a medical student, but knowing that my president is like, hey, no, this is wrong, and they can speak up on my behalf. And I know a lot of my friends felt the pressure that they had to speak up and they had to be the all-knowing people, and they had to be, and I was like, no, I have people here who have been studying this for years. And there are people here who were in the civil rights movement. Like this is not new. And they are able to speak up. I don't have to be the voice of all Black people here. Or defend stuff or whatever. I mean, I speak up a lot. That's not new. But at the same time, like I don't have to. And I can still be in an environment where I feel like my voice is being heard and my concerns are being shared and there's actions. So that's what I would say about being at a HBCU during this time. I couldn't imagine anywhere else.
And I do just want to let the listeners know too, that when we decided and prepped for this conversation, I did want to make sure with Carmen that she felt comfortable and open to talking about these issues about being a Black medical student and going to an HBCU, because I didn't want to pressure her to talk about anything or be some sort of spokesperson if she didn't want to be, because I think that's a really important thing, especially for people from my own background as a white person in our society today, need to keep in mind, is that you shouldn't just walk up to your friend who's of color and say, hey, tell me about your experience, and expect them or make them, because that's just not, it's just not cool.
Yeah. And I really do appreciate that. And I'm one of the people who's very comfortable in speaking about that, and which I don't mind. Once again, I really do accredit my background in being in Atlanta. I think it makes you a different type of person, honestly, when it comes to these issues. And it's something that for me, specifically, because I said I grew up in Atlanta, and it wasn't until I left Atlanta that I realized the world was not like it was there. Like I just did not know, and it's very different. Like the world is very, very different than it is in Atlanta. And I had no idea. I mean, how was I supposed to know, right? Like it's where I grew up. And yeah, and I would just say like thank you for saying that, because I think a lot of people, and you can what's the quote? You know, intentions don't matter, impact does, something like that, or whatever it is. Or it doesn't matter what your intention is, it matters what the impact was. And so like you said, like you checked in, you're like, hey, are you sure you want to talk about this? Is it okay? Because I know we were originally talking about like the cost of medical education. You're like, hey, you also go to HBCU if you want to, you can talk about that. And I'm like, yeah, I love it. Like, let me, like, I'm 100% okay with that. But not expecting me to, or like not, and I think for a lot of people who want to learn more and genuinely do like want to learn more from their Black friends or from their people, like their friends of color, they're like, hey, like, how, tell me about it. Like, they're genuinely interested, but it's like, I'm still processing. This is not something that is just kind of a blip in my day. This is a big deal. And it's actually a lot of emotional labor and emotional work that I have to do to like explain it to you. And then y'all, this match season has been crazy in the wake of this. It wasn't my interview, but a program director started crying when I guess she was talking about like some type of diversity issue or like the events that have happened in the last year, and she started crying and to a Black student on her interview. Like, that's not fair. Like, that is just, it's not fair. And I'm not sure, I don't think she did it on purpose. I don't think, but like, what is she supposed to do with that? Like, what is the student supposed to be on their interview trying to explain why they want to be in medicine? And then they interview, and then the program director just starts crying when she's speaking about diversity issues. Like, what am I supposed to do with that? Like, now I'm supposed to like comfort you? That's not fair.
It's not your job.
Like, and we're in such a vulnerable position right now because we're interviewing for jobs. And I'm just thinking about the student. I'm like, I wouldn't even want to go to that residency anymore because it seems like I'm going to have to be like patting people on the back for like, saying that things are racist. And like, and as being a doctor, as being an intern, or as being whatever. And it's just like, that's not fair to students. That's not fair to anybody, first of all. But like, that's just an extra thing you have to do. And I was like, you have to sit there and like coddle them all the time because this is the interview. Like, I couldn't even imagine being there, like them being close with you or anything like that. I'm just like, that's too much. Sorry.
Yeah, that is too much.
Thank you once again
for the person who, for the student, for the Black student interviewing, that's just too much, and that's not okay.
And the problem is like, there's probably going to be a couple of people who may see this video or whatever, and then we're like, oh my God, I was the one crying. And there's going to be like 7 people. Like, I did that or something like that. And they were like, are they talking about me? And I'm like, no, specifically not, but also you, because you did it. So yes.
And hopefully, if anything, if somebody is having that sort of reaction to listening to this or watching this, that they'll be able to step back and say, okay, what can I do better?
And
how can I accept what I thought?
Yeah. I think that's the thing too, is like, people feel bad when they do things like that or like get called out about things like that. And it's not that no one thought, I don't think what the program director did was malicious. I don't think that she meant to do it. I don't think that she, went into the interview like, you know what I'm going to do? I'm going to cry. Think that what anybody did, but at the same time, it's one of those impact versus intention things. And you just have to, you have to get some tough love with yourself and be like, oh, like, and it's not like you can't go apologize, but like, also don't make it like be awkward, like, oh my God, I can't believe I did that to you and blah, blah, because now we're once again still having to coddle you, but like, no, it's okay, I understand, like, all right, like, and that's still a lot of emotional labor. So, and there's no real good answers to this, of like what to do and what not to do. Like, there's really not. That's life, and you have to learn that life is just a lot of gray areas. But I mean, if you can try not to do that, that would be nice.
Right.
So, yeah.
So you talked a little bit about some of the Facebook groups and the new networking groups that have come about recently for Black medical students who are graduating this year, and also Black medical students applying into family medicine. I was wondering if you could talk a little bit more about that.
Okay, first of all, love these people. Oh my gosh. So it's once again no secret that coronavirus has definitely impacted our lives in ways that we could have never imagined this time last year or even 6 months ago, or whatever. Like, just it's really impacted our lives in such a phenomenal way, and not phenomenal as good, by the way. Anyways, so we had this group meme that we had, and it was just basically a bunch of Black students who were applying to family medicine in general, and we use it sometimes, but not like a lot. But it was really nice because, once again, a lot of Black students go to other medical schools that there's not a lot of Black students there. So, like, you're looking for a sense of community, or you're like looking for, or kind of like the example of like, girl, one of my PDs cried today. And you're like, what do I do with that? And so just kind of like talking to other Black students who may be having, and that's how I know it's happened before, because like there's other people like, oh my God, that happened to me too. Like, so anyways, but having that sense of like, oh, that happened to me too, or just having that sense of solidarity. Also, we share things like, hey, this scholarship is for, Black students who are going to family medicine, or this scholar, or, so-and-so is having a diversity meeting if anybody's interested in this program, blah, blah, blah. So, we started off doing that, but once coronavirus hit, we really ramped it up because we were desperate for community at that point. Because I think everybody kind of went through that phase where we were very isolated. This was like around like March, April, May-ish type of time where we're like, okay, let's do the virtual happy hour. And we invited some other residents who recently graduated, and we just had fun. And then we started doing like informational meetings with different residencies, had time for students to, talk one-on-one with different residents from those programs, especially, and like specifically about diversity and inclusion issues. And so one of the things I really liked about it is that the PD would be there, or the residents will be there, and I would have people send me anonymous questions, or they would send it to me so I knew who it was, but I would ask them. And so like those uncomfortable situational questions like, hey, why don't you have any Black people at your residency? Or like, what are you doing? Like, what's your patient population? Or what happens if a resident gets pregnant? What are you going to do? Like, so asking those really uncomfortable questions that you wouldn't feel comfortable asking, during your interview, or et cetera. And then also we had a lot of things where like navigating academic medicine as a Black professional, and just kind of like the traps you can get caught into. I'm really passionate about diversity and inclusion. So it's not so much of a trap for me, but like it really can be that, will push diversity and inclusion projects or positions on Black people for the sake of just them being Black, like they're like, oh, you must want to do this because you're Black. So why would you not want to be the diversity inclusion face or the, chair or whatever? And that's unfair. We already know that. Anyways, so just asking those things, navigating that personal statement help, ERAS help, etc. And just, these are my friends now. And now I have a community, and we all have a community of different Black doctors who are going to be around the country that we're going to know for our careers. And that's impactful, especially like when things like this come up. Like, of course, we had space where we were able to talk about like, hey, what's happening at your med school in regards towards the, police brutality, or what are they saying? And then a lot of the students were like, no, they're not doing anything. Or they said that we can't post anything, or they said this, or like I got in trouble for posting something, or one of my classmates said something very like not even a little bit racist, and they're not getting any consequences for it or something.
Wow.
Like, and Will it fix things? Probably not. I wouldn't say probably not, but like it helps to be able to have a space that you can commune and you can talk about the things that are happening to you and feel like you can have an environment. So
Mhm.
I don't want to say it's like an HBCU. That's going way too far, but kind of like what I was talking about, being at an HBCU and having that support all around me, having this group and having people being able to like have a community and have support and have things that they can just vent to and feel like they're supported. So it's been great.
Good.
Yeah, I love them. I really love
Mhm.
them.
So a little bit too about, because I know you mentioned this when you're
Yeah,
asking, residency directors some tough questions about patient populations. And I know when we
yeah.
were preparing for these podcasts, we talked a little bit about what is the most effective way and what is not effective when it comes to taking care of underserved populations. So I was wondering whether we could maybe
Oh my
shift
gosh.
gears and talk about that a little bit.
Yes, yes, yes. And I want to say this very clearly. If you do not have a passion to work with the underserved, don't. Like, just don't. Like, that's not, I'm not going to say it's okay. I mean, and the thing is, if you don't want to do something, don't hop on because you think you have to say that to do whatever you want to do. If that's not what you want to do, don't, because it shows in your patient care, it shows on your face, it shows in your attitude, it shows in the way you carry yourself that you don't want to be here. And people aren't stupid. People pick up on that. So it's like, don't be resentful because you wanted to pretend or like say you want to do something and like I'm not going into orthopedic surgery, right?
Mhm.
Like I don't want to. I really don't. And it feels like some people who are working with underserved people are family med practitioners who are in the ortho suite. And it's like, yeah, I can do it, but it's not what I want to do. Like I said it because it was cool. And then now here I am chopping off somebody's leg, and I really didn't want to do that to begin with. And I mean, you get it's a silly example, but the thing is like, don't force something that you don't want to do because it really shows. That's
Mhm.
actually a bad example because I loved my ortho rotation and it was really fun being in the OR. But the point is, like, it was so fun. It was so great. I do a lot of DIY projects so I was like, this is great. This is like a DIY project on a knee. This is cool. But anyways, I was just like, if you don't want to, don't. For like, please don't. Like, find a like. I don't know what you have to say as an excuse or whatever. If whatever makes you feel comfortable, but I promise you, everybody will be happier, and including the patients that you are not there working with them. Um, and then also for those who do want to work with underserved populations, um, don't force it. You know, like what's that? It's that meme where he's like, oh, please don't look at my nail. My nail broke off. But he was like, oh, what's up, cool guys, or whatever. And it's a meme, and he's like old and he's in high school, and he's just like clearly an imposter trying to really, really hard to fit in. And you're just like, just be yourself. Like you really can't be yourself. And I know I have no idea what it's like to be a white woman or, a white man, but like you don't have to put on a different persona or act a certain way or talk a certain way or, just really be yourself and talk to people like they're normal. Um, and I get that it's not necessarily purposeful all the time. And I don't think people like go in trying to change the way they act on purpose, but it happens a lot. And so it's just like, hey, just chill out, take a deep breath. And then also, like, the work is not easy. It's not glamorous. It's not easy. It's not fun. It will weigh you down. There is a resource dynamic. You'll get angry that, why can't I give my patient this when I give my other patients this medication all the time? And now I all of a sudden can't give this medication that I know is going to work. Or why is it that my patient has to wait so long to get a chest x-ray or something? Like those things it's not easy work. And it's okay to say like, this is not easy work. So it's not going to be glitz and glamour and you're not going to go in there. And I think sometimes too, is like, you don't really see a lot of change. And so that's also really, it drains you a little bit because you're like, wow, I'm working so hard. I'm giving so much of myself and nothing's changing around me. And it's like, it's not that nothing is changing, but it's really hard to appreciate what those impacts are on a daily basis when you're like, wow, I've been here for so long and it seems like nothing's different and nothing's going to change. And that it's hard. It's it's really really hard work. So just give yourself grace, give yourself just some like, hey, these some days are going to be a lot harder than others and some days you're really not going to want to do it. And just because some days you have are bad doesn't mean that one, you're a bad person, or also that this work isn't for you. It just means that sometimes it sucks. So I would say that. But biggest thing, if you don't want to do it, just please don't. Like, just don't. Like, everybody can tell. You're not fooling anybody. Like, and that's not about, Black people versus white people or anything like that. That's a pretty general thing. There's a lot of people in general who don't want to work with the underserved. And I'm not gonna say that's okay, but at the same time, if you don't want to, be real with yourself and be like, hey, this is not what I want to do. This is not the environment I want to work with. There.
Yeah, that's really insightful. And I think that is a really important point. And hopefully if any, especially pre-meds, people thinking about going to med school hear that, they'll hear that too, because it's something I think would be important to keep in mind, throughout the journey of becoming a doctor.
Yeah, I think I don't know, right? But it seems to me that it's been really trendy to say that you want to work with the underserved.
Mm-hmm.
And I'm just like, I get why it is trendy and I get why people say it, but there's so many different interests you can have in so many different ways. Or, some people think like one population is underserved versus others. So my passion specifically is women's health. So I want to work with um, lower socioeconomic women who are pregnant for the most part, or who become pregnant. That's a real passion of mine. Those who are Spanish speaking, those who are, maybe uninsured, underinsured. That's what I want to do. And that's okay. And if somebody else wants to work with like an elderly population, and that's like, you don't have to say that they don't have to be underserved, but if they have a focus in an elderly population, that's fine. Like, you don't have to say like, you don't have to pretend to be interested in my patient population for the sake of being saying you're interested because you think it's what the right and answer or what people are looking for. And I think the thing is, people can tell a mile away if you're not being genuine. And that's admissions, that's matching, that's the patients, that's everybody, that's your peers, and people will hate you for it because that sucks for everybody. It makes everybody miserable. So
it's really thinking about, how is somebody going to be able to be a productive member of the medical team and the medical community instead of just saying they're going to be there to do one thing or another. It's how are you actually going to be productive, and doing something or saying you're going to do something you don't really want to do is not productive,
it's not. So yeah, that's the perfect way. Just be a team player and be a team player on the team you want to be on. So
Right. So it'd be interesting to hear a little bit more specifically about your experiences working as a medical student in Nashville with underserved communities, and also for context for the listeners, I'm actually from Nashville myself. I grew up there, moved there with my family when I was 4 and grew up in that area. So it'd be interesting to hear from since I don't go to medical school in Nashville, a little bit more about, working with underserved communities in Nashville.
Yeah. So once again, Meharry, this is like their mission. Like one of the things that really, other than all the other stuff I said, but one of the things that I really love about Meharry is that it's very, very mission based. Like that is something that they are very serious about. And it's service, it's worship of God through service to mankind. which is a really interesting mission to me, like, or motto or saying, because I really feel like that's what we do. And not even in like in a religious sense, but in a, like, our goal is to service, period. So our hospital takes literally anybody that we can service, no matter what the status of their, I I honestly just assume all my patients don't have insurance. Like, that is my baseline. Like, I'm actually shocked when they have insurance. And of course it doesn't, I'm not gonna say it doesn't affect our patient care, because I think it does affect our patient care, not in this way that we handle patients, but in, like I said, the services and the things that we're going to be able to provide them. It's different, which sucks in so many levels, and that's a whole different rant. But the thing is, I really love that Meharry has really taught me how to make sure to how to use my social workers, how to use my community resources, how to make sure that I'm being um, conscious of what patients need, how they can afford it. We have a food bank now, and it's like a produce bank. They have like fresh vegetables. We have a farmers market that comes out, and you can just like get food. It's great. It's really great. Of course. Oh my gosh, I haven't actually been here in a while. I don't even know if we'd be able. I don't think we have our farmers market anymore because of Corona. Um, Lucky Corona. She's been great. Wow. Speaking of Corona, so Nashville, we actually are doing the testing for all of Nashville. So
Wow.
Meharry was like, I mean, I'm not surprised, because once again, this is who we are. But when this is in March, like, we set up all the testing centers in Nashville. So we have it one literally outside of my door at Meharry's campus. I live on campus. Literally outside of my door, there's a testing center. There's a testing center at different churches. We partner with different churches. And then we have one at Nissan Stadium, and we were running those. And for a while it was Meharry students and faculty who were running it. Now it's more like a mix, because I mean, the longevity, we had to go back to class and we had to go back to clinic. So now there's there's other people who are not running it now. So it's still like the Meharrians on the floor, but like there's less students there than there were, and less faculty, as many faculty, but we're still running them. And I mean, we test thousands of people a day. Like, it's crazy. Free. Like, you come in, you get tested, that's it. You get your results in like a day. Like, I mean, it's crazy. And we're running that. For our, like I said, we partner with a lot of churches. Baseline, when things were, quote unquote normal, we have a free clinic. Once again, you can come there. No one has insurance there. I think, once again, if you have insurance, we're like, oh, okay, well, all right, that's cool. And then, but a free clinic, anything you get there, it's free. We have a lot of partnerships in the community. We just, like, there's so many service projects. Like, there's just so many. And working with the population that we do, fun fact, they tried to close down our hospital. God, was that 2 years ago? And to make it only an outpatient hospital. And it was very scandalous, because no one knew, and it was just like a random announcement one day, at whatever. But the community was like, and I mean, everybody was like, where are these patients going to go?
Right.
What are you talking about? Like, Meharry is the one that is servicing these patients. Like, you can't shut down the hospital. Like, then they're not going to have anywhere to go, or anywhere to take care of them. So long story short, that did not happen. But that just kind of once again shows that even to people who don't even go to the hospital, or don't even like come, that it was absolutely it wasn't possible to shut down our hospital. I don't even know why they said they're gonna. It was scandalous. It was all very not great. But
Yeah, it sounds like it was pretty bad. Pretty shocking experience.
It was very shocking. I mean, of course, like, in the medicine, like, we were like, the residents were like, what do you mean they're gonna shut down my hospital? Because, you know, we have residents. And then for us, we were like, what hospital are we gonna go to? And I mean, that's on like a, you know, not a selfish basis, but like kind of like this is very impactful. And I think that sometimes, kind of going back to what we were talking about before, is what's the impact of HBCUs and what's the impact of Meharry and what's the impact. And it's that a lot of, or the misconceptions too, is that they don't think that a lot of people don't think we do a lot. And then all of a sudden, like, if Meharry was shut down tomorrow, Nashville wouldn't have a single testing center. Like,
that's a pretty big impact. And that's honestly something I didn't really know that much about. And to learn about that, that's really critical. And it's really great to hear that Meharry's been doing that, and that I hope that they'll continue to get more support. I do remember reading you guys had some hiccups with the vaccine distribution, which was just so messed up with all this considered. Just like, they seriously did that.
And Jesus Christ. It's so, and that's the thing, like, people will be like, oh, that was just some honest mistake. And it's like, how? It's not a mistake. It's not a mistake. If you have something that is a pattern over and over and over and over again, and like I said, we're the ones doing the testing for Nashville, like us, like our faculty, our students, our campus, like our church relationships, us have been doing this. And somehow we didn't get we got overlooked, or it was a snafu or something, that we didn't get the vaccines, when it's once again, and I'm not being shady to any other hospitals or any other schools in town, but it's somehow we are always, oh, I don't know how this happened. I don't know how this, you know, thing that has happened every single time for the last 150 years happened again. Like, and it's just, and it's infuriating, because you're like, oh, surely that it is not like we're like trying to gain respect or anything like that, because that's not the point. The thing is just like, wow, this has been happening for, I'm about to curse, this has been happening for like 200 years. When are we going to get past this? Or when will this not be an issue? And the thing is, we know it will always be an issue. And then, you know, people try to gaslight you, like, oh, well, maybe they just thought, like, there's no maybe. Okay. This is all like, and even if it wasn't maybe, that's stupid. Like, how do you, like, we're a medical school. So that just, that really, that honestly, there's been a lot of upsetting situations in Nashville with regard to Meharry, but I would say that one was probably one of the times where I was like, y'all are effing kidding me, because this right here it was disrespectful.
Right.
Like, and I think that was real, and especially in like even if we weren't doing the testing, like, which is something, we are a medical school in Nashville, like, baseline. We're a hospital in Nashville.
You should have access to the same exact resources
that every other hospital and medical school got access to. So just baseline. And then on top of that, we've been the ones since March, and it's still going. Like, we closed on weekends now. At first we were doing it every day, but now, like, we've been doing this since March, and it's January, and there's no end in sight of when this is going to be done. And then y'all didn't give us the vaccine, or y'all somehow overlooked Meharry. And it's just like, it's inferior. Like, it really is. So.
Right. Well, I think one way to wrap up here, I think it would be interesting to talk a little bit about, you know, what you've perceived working with the community about coronavirus, about the vaccine, what you've heard from patients, how you approach different situations of patients having questions or concerns or skepticism. How do you navigate that?
So there is a very turbulent history with Black patients and the medical community, and as it should be, because the medical community has done some atrocious things to Black patients and patients of color, Hispanic patients. Like, this is, it really has been an atrocious history.
Mhm.
And I think that people should really, I think people know that technically, um, but they don't really give it the same, they don't really give it a depth that it needs. So of course you have the things like where people are like, oh, the Black community doesn't trust the med community, and I'm like, yeah, rightfully so. Like, I'm also, I'll be a doctor in a couple of months, but every day I'm like, I have more of a skeptical view of everything that is published, everything that is said, everything, because the thing is, I like, I'm Black first. Like, this is who I am, and like, I know the history of what's happened to my people in regards to medical education and studies. So the thing is, um first of all, I wasn't, okay, let me say this. It's not that I was scared of the vaccine. That wasn't what it was. It was that I'm like, wow, this is like kind of sketch. It's so fast, blah, 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 etc. So, and then I also know that my family and friends are going to be looking to me to like, not just, and the thing is like, that's a whole nother thing too, but for a lot of us, for Black doctors, it's our family and friends that I mean, of course they put a lot of trust in us, but I feel like even our, what we say and what we do is even more impactful for our communities, because once again, this trust has been so broken throughout our community. So like, we really have to be I feel like we have to be more knowledgeable than like some of our counterparts, because what we say and what we do is like, has some, not consequences, but it's just much more impactful. Anywho, so I was like, okay, I need to research this. I need to figure out what's going on here, so I can, one, be safe for myself, because I figured I was going to have to get the vaccine because I was a medical professional. I didn't think I was going to actually have a real choice in the matter. And then two, so if I can tell my friends and family like what this is. And so I researched, I was uncomfortable at first. And I, like I said, it's my, as a Black person, for me at least, it is my first instinct to be skeptical of any new, latest, greatest, like vaccine type, experimental type of thing, right? That is just my first inkling. And then, so I researched, I realized that, basically the whole world stopped what they were doing, worked on the vaccine, were able to sequence DNA and just sequence genomes in record time that we weren't able to do in prior history, how many people were in the trials when they started the trials, and then also about the funding and how the funding was virtually unlimited. And so I was like, okay, now I see that this is safe. It's been proven safe. I understand the science behind it. I get, oh, and that was the other thing. I was like, oh, the it's mRNA, and I was like, we haven't. I was like, have we had it mRNA? I was like, I know a lot of things, but I feel like I haven't read anything about an mRNA vaccine. So that was something also that I was trying to figure out, like the technology behind that, because that's newer. Um, and I was like, so just really researching and really trying to figure it out. And then also talking to a lot of old people, like old people, but like old attendings, the experienced, seasoned attendings, white and Black, honestly, and just also the researchers. One of my good friends, she's so smart. She has like 1 billion degrees. I listened to her, and she's also Black, and just kind of really understanding what's going on. And so I felt way more comfortable and way more secure about the vaccine. And then I was able to tell my friends and family about it. Um, and regards to patients, same thing, same things that they had concerned with. It was like, why would I take something that we don't know the long-term effects of? Why would I do this? And then of course there's a lot of political gain around the vaccine. And there was a lot of, it was really weird. Like I didn't really trust the last administration. It seemed like this vaccine was like something they were trying to push to, for political gain. And I was like, I'm not trying to be part of a political pawn, which once again was a lot of the questions that my friends and family and patients had. And of course, you have people talking about like the wild conspiracy theories about the microchips and stuff like that. Um, I really feel like that's also something that I don't like per se, because I feel like a lot of people have made it seem that like Black people have been just like stupid and like, oh, that's so, the microchips and the 5G and the what was the other one? There's like I don't know, whatever. And they try to make it seem like Black people were anti-vaxxers. And I was like, there's a very different history between anti-vaxxers and why Black people don't want to get something that's still considered experimental.
Right.
Like
Yeah.
that's, and I feel like people were trying to put um, them into the same category and be like, why would you not want to do something that could help you or whatever and blah, blah, blah. And it wasn't, so it's like, once again, speaking to people's like, I can't remember now, but speaking to like, even though you can speak facts to somebody, if somebody's not, you know, their argument is not in the realm of facts, it's in the realm of like how they feel, how they, you know, things. So like you can't fight logic with emotion, you know, or vice versa.
Mhm.
So when I would talk to my patients, I'm like, hey, I know everybody's telling you to take this vaccine and they seem so sure about it, but you're hesitant. And I want to let you know I was hesitant. And these are the reasons why I was hesitant, which is likely the reasons why they were hesitant. And this is what I did to overcome that. And here's what I found in my research. And it wasn't that like they didn't think the technology was good. It wasn't that they didn't think this or that or whatever. I was like, hey, I know where you're coming from. I understand your skepticism. I too was skeptical and I had to do my own research and really understand what was going on versus like, why wouldn't you just take the vaccine? Like that doesn't, it's not effective. And I shout out to family medicine. But I think family medicine in general does a really good point with this and primary care because you know, peds and family, we give a lot of vaccines. We do. And that's where, and so we have a lot of experience in talking about vaccines and how to relate to it and how to identify what's the issue here. And I really like that training, but also it just seems that a lot, yeah, just a lot of people are hesitant, and I mean for good reason. Like this has been a scary year, and to have something that's new, has something that's experimental, has something that we don't know the long-term effects of, is really crazy. But I was like, and I tell people all the time, I was like, we don't know the long-term effects of this vaccine, but I can tell you the short-term effects of COVID. And that, and I think from there, and I mean I have some, once again, social media, but Facebook and Twitter posts about like, hey, this is what the vaccine is. This is my same, you know, spiel about why I was hesitant, why I'm not now. And I have people telling me who I didn't even think were reading my posts, like people I'm not close to. This is like Facebook. So these are people from like middle school, like and stuff like that. Or and they're like, hey, Carmen, I'm going to be getting the vaccine now because of what you posted. And once again, I'm a medical student. I'll be a doctor in a couple of months. Yeah, sure. But even the impact I've had in my social economic class that doesn't have a lot of access to a lot of doctors, doesn't have a lot of access to a lot of medical professionals, at you know what I'm saying? I was able to be like a spokesperson in my community. And then now people are like, hey, Carmen, can you, and that's not even vaccines. That's, hey, Carmen, I'm pregnant. Um, how should I go about this? Or like, what should I do? And then I post a lot of things about breastfeeding, a lot of things about that. And a lot of people come to me and be like, hey, I didn't know those things about this. And now I'm a doula. So I say things about doulas and like, hey, I didn't know anything about doulas. And that's the impact you have as a Black physician that I feel like is not necessarily the same in other communities. And it's, I mean, it's actually really scary because you really have to be on your stuff. Like you really have to know your things because people take what you say. And I mean, this is for all doctors, I think so. But I think once again, especially in the Black community, because we've had so much turbulence in our trust, that when a Black doctor says something, it is extremely powerful. And which is scary, but also really nice that I've been able to touch people and then maybe help educate people, and people also feel like more comfortable with the medical community and just kind of being a bridge and being somebody that's able to transform this relationship. So
Great. Well, that's about
I know
wrapping
sounds
up
a
the
lot.
time we have for this was I would love to just keep talking and make 10 podcasts on this. I'm really glad, Carmen, that we were able to sit down and talk about this today. I know I've learned a lot in our conversation, and I really appreciate your willingness to come on and talk and be a part of this mini series for our podcast and all the work that you've been doing and sharing all that with us. So thank you so much for that. And I hope that our listeners have also really enjoyed this conversation and have learned a lot and are going to be motivated to learn even more. And I look forward to continuing to work with you and seeing all the great things you're going to do, and good luck with the match day. And I can't wait to see the impact you make moving forward.
Thank you. And seriously, thank you so much for doing this. I am really excited. And just the way, like, I mean, you mentioned it before, but the way y'all went about this was just so respectful and just so awesome. So just thank you.
Thank you. I appreciate you doing that. And hope you have a good rest of your day. And thank you, everyone, for listening.
Bye, everybody.